Hi, my name is Dr. Rudra Mohan. I'm your friendly neighborhood dentist, and through this oral health channel, let me talk about one mistake that periodontitis patients make very regularly and they suffer because of it. Let's start. So I get a lot of calls from patients who are suffering from periodontitis and they have just one complaint, that they get the cleaning done from the dentist, a regular dentist or a periodontist, and they are advised an astringent gel or an astringent paint, after which they are directed to do gum massage, because of which their symptoms go away and they feel that the disease has resolved. Now what happens is, most of the time, till the time that they're doing gum massage, there's symptoms such as painful gums, swollen gums, redness in the gums, or bleeding, in the gums while they're spitting, or bleeding on brushing. That all gets, either relieved or masked. What happens is that once the medication is over, right? Once the course of the medication is over, or once the tube of the gel or the paint is actually gone and it's finished, we seldom forget to use it again and do the gum massage. So what happens is that your symptoms tend to return, and now you are obviously surprised as to why it has happened. Now let me break this myth for you. What actually happens? See, the end point of scaling is to reduce the inflammation, that is the infection that is persistent in the gums, and the gingival massage also helps in treating it. But that happens mostly in cases of gingivitis. So you will get a lot of resolution when it comes to gingivitis, but if you have periodontitis, that means you have pockets, you have bone loss, you have defects, and you have stuff like food lodgement and malpositioned teeth, and you have teeth that are probably mobile, which has a lot of collection of tartar below the gums. Now you have to understand that when you are using an astringent and you are using a gum massage with the astringent, you are definitely treating the stuff at the gingival level, that means on the outer surface of the gums. But when it comes to your bones and the teeth area and the perioral area of the teeth, right around the roots, where there is still built up of plaque and tartar which has not been taken care of because you've just got a cleaning or a scaling done, and you might require some other non-surgical therapy such as root planing or curettage or deep cleaning or further flap surgeries, for whatever the case might be, you are just treating the symptom and not the cause. Let me tell you something very honestly. So definitely I understand that for every patient, if you get relief from the symptoms, obviously you will feel that the disease is gone. That's common sense. But that is why I keep on trying to egg you on, all of you who are suffering from pyria related issues, to go to a gum specialist, that is a periodontist, because they will do a thorough examination and they will find out the problem areas where you need more intervention than just scaling, oral prophylaxis, and just a gum massage. So you have to understand that you can relieve the symptoms with the gum massage and the scaling, but that is not the end point, because you need to take care of the cause, that is the plaque and the tartar, and that's the buildup that is taking place below the gums and causing you problems. Now these problems are getting masked because of the fact that you're using the astringent and the gum massage, which is very good, which is a very good practice, but that is not the end of the line when it comes to periodontitis patients. It might be the end of the line for the gingivitis patients, but means that the lesions are early in the stage. They're not very severe or they're not very moderate. They're just very slightly, in a very nascent stage that they are. So that can be controlled. So that's what I'm trying to say, that if you are suffering from stuff like food lodgement, you're suffering from swollen gums, you're suffering from bleeding on brushing, which is not as regular as gingivitis. You might get a huge blood taint sputum when you're brushing and when you're spitting. So think about it, and if you feel like that these problems are reflecting or correlating with you, it is high time that you need to go to a periodontal surgeon, that is a gum specialist, and get yourself evaluated clinically as well as radiographically, get the x-rays done, so that they can do an analysis of the case and then tell you your concomitant and the appropriate treatment plan. So this was today's episode. Please like, share and subscribe, and do press the bell icon for the important updates. If you feel the need to contact me, here are my social media handles. However, I would request you not to call me directly on phone or through WhatsApp, so that we can just drop me a message so that we can talk about it and we can take care of your queries, apprehensions and questions. That's it for today. Thank you.